Welcome to Everyday Nursing Knowledge Lectures, and today we will learn increased intracranial pressure. What is intracranial pressure? It is the pressure within the skull and it's on the brain tissue. And what contributes to this ICP? So ICP is caused by brain tissue itself, blood supply to the brain, and cerebrospinal fluid, CSF, that protects the brain and the spinal cord. Normal ICP is 5 to 15 mmHg, or it should be less than 15 mmHg. So if you have a patient on continuous ICP monitor and you see a ICP greater than 15, and if you see a sustained ICP greater than 20, remember it's a medical emergency. It is called intracranial hypertension. What happens when the ICP increases greater than 20 is there is increased pressure within the brain tissue and the brain is enclosed within the skull. There is no space for the brain to expand. So ICP, or pressure within the brain, increases. As a result, blood supply to the brain decreases. Now, brain is deprived. Brain is not receiving blood and oxygen. That leads to permanent brain damage. So it is a medical emergency and it needs immediate treatment. Now, what causes increased ICP? Remember three factors that contributes to ICP, which is brain tissue, blood supply, and CSF. So any trauma or disease that can alter the normal anatomy or increase the volume of brain tissue, blood supply, or CSF leads to increased ICP. Example, a head trauma or injury to the brain, tumor within the brain, infection, example, meningitis, encephalitis, hematoma, blood collection within the brain, or hemorrhagic stroke, bleeding into the brain, hydrocephalus, a block in the CSF pathway. All these disease conditions can lead to increased ICP. Now, what are the effects of increased ICP? As ICP increases, there will be decrease in CPP. CPP is cerebral perfusion pressure. That is the pressure required for cerebral perfusion, or pressure required to maintain adequate blood supply to the brain. Normal CPP is 60 to 100 mmHg, and you will get normal CPP by subtracting ICP from MAP. MAP is mean arterial pressure. It is the average pressure during a cardiac cycle. So when you subtract ICP from MAP, you will get the CPP, which is the cerebral perfusion pressure, or pressure required for adequate blood supply to the brain. Example, if a patient's MAP is 78 and patient is on continuous ICP monitor and ICP reading shows 14, CPP is equal to MAP minus ICP, that is 78 minus 14, which is 64, which is normal CPP. And if you see an increase in ICP, and if ICP increases to 20, let's calculate the CPP. CPP is equal to MAP minus ICP. MAP is 78, ICP is 20, which gives you 58. So now there's a drop in CPP, drop in cerebral perfusion pressure, that can lead to decreased blood supply to the brain and can lead to permanent brain damage. Now, what are the signs and symptoms of increased ICP? Early signs and symptoms are headache, vomiting. It can be projectile, that means without complaints of nausea. Vision changes, patient may have double vision. Altered mental status, patient may be confused, restlessness. And these are the early signs of increased ICP. And as ICP increases, you will see a change in the pupil size, irregular dilated pupil, papilledema, swelling of the optic nerve, motor deficit or weakness, and seizures. And if this increased ICP is not treated, that progress to late signs and symptoms, which is deteriorating, which is bad. That is deterioration of level of consciousness or Glasgow Coma scale, patient become comatose. Cushing triad. Cushing triad is a late sign of increased intracranial pressure. In Cushing triad, you will see a decreased heart rate, widened pulse pressure, and irregular respiration. Three signs. Widened pulse pressure. So pulse pressure is the difference between systolic and diastolic. Example, if the patient's systolic is 120 and the diastolic blood pressure is 80, pulse pressure is 120 minus 80, that gives you 40. Now in Cushing triad, the pulse pressure is widened. That means systolic increases and diastolic decreases. Example, systolic increase to 180 and a diastolic drop to 40. Now the pulse pressure is 180 minus 40, that gives 140. So you will see an increased pulse pressure or widened pulse pressure. Now, what causes this widened pulse pressure? The increased systolic blood pressure is because of stimulation of sympathetic nervous system. Now there is an increase in ICP. As a result, brain is not getting enough blood. So body is trying to compensate by increasing the systolic blood pressure, increasing the blood supply to the brain. So you will see increased systolic blood pressure. And as the systolic blood pressure goes up, parasympathetic nervous system gets activated. You want to bring down this blood pressure. As a result, heart rate drops to decrease the blood pressure. So you will see a decrease in heart rate and a widened pulse pressure. Now, irregular respiration is because of the brainstem damage or dysfunction from the increased ICP. You will see Cheyne-Stokes respiration, that is tachypnea followed by period of apnea. Now let's see the management of increased ICP. So always treat the underlying cause. If it is related to the infection, treat the infection. If related to tumor, removal of tumor, etc. The position, always keep the head of the bed 30 to 45 and neck in neutral alignment. When you flex the neck, it decreases venous return back to the heart. As a result, ICP increases. Avoid flexion of the hip. When you flex the hip, the intra-abdominal pressure increases, which further increases intrathoracic pressure. So when there is increased intrathoracic pressure, blood return or venous return to the heart decreases. As a result, ICP increases. Now, environment should be calm for neuro patient or increased ICP patient. Should be calm, cluster care, and prevent overstimuli. Temperature, maintain normal temperature, because if a patient has fever, give antipyretics. If fever or temperature increases, remember there is increased metabolism, there is increased perfusion, and that can lead to increased ICP. Prevent shivering. When shivering happens, it increases the body's metabolism, and when it increases, carbon dioxide is produced as a byproduct. Now remember, carbon dioxide is a vasodilator. When carbon dioxide increases in our body, vasodilation happens to blow off this carbon dioxide. As a result, cerebral arteries dilate, and that dilation can cause increased ICP. Now, oxygenation. You prevent hypoxia and hyperventilate the patient. A patient with increased ICP, you want to hyperventilate or decrease the carbon dioxide. The reason is, again, carbon dioxide is a vasodilator and you don't want the cerebral arteries to dilate. So you decrease the carbon dioxide, you hyperventilate the patient. As a result, vasoconstriction happens. Cerebral arteries constrict, and this can decrease ICP. Now let's see the medication used to treat increased ICP. One is mannitol. Mannitol is an osmotic diuretic. It pulls fluid back to the blood vessels from the tissues. As a result, cells shrink and is excreted. So you will see decrease in the cerebral edema and decrease in ICP. So you have to monitor the output, because you will see a sudden increase in the urine output, and hold mannitol if the serum osmolality greater than 320. The reason is mannitol pulls fluid back to the blood vessel. The concentration can increase. So hold if serum osmolality greater than 320. Next is 3% saline. It is a hyperosmolar fluid or hypertonic. Anytime you give hypertonic fluid is pulled back from the tissues to the blood. As a result, cells shrink. So cerebral edema decreases, ICP decreases. So you have to watch for fluid overload, because you are increasing the volume in the blood. Also monitor for the serum sodium and osmolality. Anticonvulsants to prevent seizures. Corticosteroid, example dexamethasone, it's an anti-inflammatory. Sedation if required, barbiturate, example phenobarbital. Paralytics if shivering, if needed. Vasopressors, if the blood pressure is low, add vasopressors to increase the MAP. Or to keep MAP above certain level, you can add vasopressors. Now the surgical management involves external ventricular drain. It is the catheter inserted into the lateral ventricle to drain the CSF. So when the CSF is draining, it decreases the intracranial pressure. Another surgical management is shunt placement. Shunt is placed between the ventricle and the peritoneum, and it allows CSF drainage and thus decreases the ICP. The third is decompressive craniectomy. It is the removal of a part of the skull, and it allows the brain tissue to expand without damage. So today we learned about increased intracranial pressure, and thanks for watching my video.